So welcome back to our channel Healing Vibes. In today's video we are starting with the toxicology, and the today's topic is classification of poison, which are very frequently asked question in university exam, and the sub questions also ask like the types of the poisons. So we are starting with the poisons. So for that, what is poison? The things which produce harmful effect on human body. Anything. It may be phenyl, it may be harpic, it may be bleaching or dyes, it may be castor oil or castor seeds. Anything which produce the harmful effect on the body are the poison. Anything which are having excess, we're taking in excess and they are producing harmful effect on the body, or we're producing or may injure the patient tracts, they are poison. So there are six type of poison basically. There are corrosive, irritant, cardiac, asphyxiant, neurotic, and miscellaneous. In corrosive, as name suggests, it corrode the tract, mainly GI tract, because mainly the patient inhale and ingest the poison. So basically the key point for corrosive is inflammation and for ulceration. In irritant, it is also the same. It irritates the tract, it produces ulceration and cause redness. In cardiac, it directly acts on respiration. On heart. Asphyxiant act on respiration. Neurotic act on the brain, spinal cord, and peripheral nervous system. And miscellaneous is a different group. Now we are starting with the corrosive. So basically in corrosive, as I already said, that the key point for this, it produces inflammation as well as ulceration. And the group which cause corrosive poisoning consist of strong acid and strong alkali. In strong acid we can say HCl, we can say nitric acid. In strong alkali we can say NaOH, caustic potash and all. The phenyl, harpic, the bleach, the dyes are included in the corrosive poisoning. Now the second, and the corrosive poisoning also asked in SAQ as a separate question. And the important point in the corrosive poisoning is about gastric lavage. That gastric lavage is a process of removing the stomach content when the patient ingest the poison. To withdraw that poison, there is a process of gastric lavage. In that, the tube is passed through the mouth. So this process is not used in the corrosive poisoning because it requires the tube, and this tube may corrode the esophagus and stomach because there is already ulcerations in the tract. So this is a very important MCQ question, that gastric lavage is not used in the corrosive poisoning. Now another type of poisoning is irritant poison. Irritant poison, we can say when the corrosive poison is diluted, it may act as an irritant. And there are some characteristic symptoms of the irritant, like abdomen, like pain in abdomen, vomiting and purging. And during post-mortem or autopsy, we can easily see the redness and the ulceration GI tract. It produces both of them. And as well, yes, it irritates the tract. And we divide it into three parts, like inorganic, organic and mechanical. In inorganic, you have to memorize the example. In inorganic, there are metallic and non-metallic. So in non-metallic, we can say about the halogen group, in which there is chlorine, bromine and iodine. In metals, the metal which are harmful, like arsenic, the lead, the copper, we know about the lead poisoning, mercury, and the radioactive substance like barium and all. So this is come under inorganic thing. In organic, the croton seed, castor seed, The thing about castor seed, the castor seed is poisonous when we take in a raw form, but when we use castor seed oil, that is harmless. And the thing which have effect, the drug which have effect on stomach, like croton, collocin, which come under irritant, the croton, collocin, and anacardium, capsicum, calotropis. Now there it also include animal poison, that is snake, scorpio, spiders. In mechanical, there are the powder of glass, diamond dust, chop hair. No one can imagine the chop hair is such act as a poison, but yes, it act. And now another type is neurotic poison. Neurotic, it name suggests it act on nervous system, and in three parts: in cerebrum, spinal, and the peripheral nervous system. So it has three types of poison. Now it also here act as a local irritant, and in there are chief symptoms which are characteristic, like it produce stimulatory effect and inhibitory effect. Not I can say inhibitory, but it depress the functions. So in headache, drowsiness, giddiness, delirium, coma, stupor, this is a depressed function, or not function, the depressed symptom. The convulsion, paralysis are the stimulatory symptoms. Now the inhalation or ingestion of the neurotic substance is not found out in the post-mortem examination, but it found through the history and symptom of the patient, and also by doing the analysis of viscera, mainly of stomach, mainly of duodenum and jejunum ileum. By analysis of the viscera, we can say that the patient has taken the neurotic poison. Now in cerebrum, it also has three types of effect: somniferous, inebriant, and deliriant. Now the somniferous is something related to somnolence, that is intense desire to sleep. So example, opioids. Inebriant, which produce the effect of drunkenness, intoxication, that is liquor, that is alcohol, anesthesia, and fuel. Now other was deliriant. Delirium, try of delirium, datura, belladonna, and hyoscyamus. Easy one. In spinal, great paralyzer, gelsemium, and nux vomica. In peripheral, there is curare and conium. Now we have another type, cardiac. Cardiac poison act on heart, so it may have tachycardia effect and bradycardial effect, which include drugs like digitalis, aconite. And asphyxiation act on respiration, so it include irrespirable gases like CO, carbon monoxide, and carbon dioxide. We know about the carbon monoxide poisoning. Now last type was miscellaneous. It is a different, basically, because it has different pharmacological action which are different from other groups, so it is considered under a different group. So it has include analgesic, antipyretic, antihistaminic effect, and antidepressant stimulant effect. So thank you, done for today. Like the video please.